Well, Brazil is one of the main foci of Leishmaniasis in the world. It's the largest one in Latin America. And compared with Europe, for example, the Mediterranean region, we have Italy, for example, which is an endemic area for visceral leishmaniasis, in average 200 cases per year. In Brazil, as I mentioned, we have over 3,000 cases per year, so it's much larger. It's much a bigger problem in Brazil as compared to many other endemic areas. However, in Europe, the situation is changing. In Italy, for example, the disease used to be more common in the southern parts, in the southern regions. It's a traditional endemic area, but nowadays the disease is coming up to the north due to climate change and movements of affected dogs and people. So in areas in the north that usually were considered to be free of leishmaniasis, nowadays we have endemic areas, endemic foci as well. It's very important for veterinarians to communicate with dog owners about the importance of those vector-borne diseases because many of those vector-borne pathogens can also infect humans. So reducing the risk of infection in dogs, actually protecting dogs, can also reduce the risk of infection in humans as well. In terms of prevention, currently in the market there are many tools or strategies such as repellents, vaccination, immunomodulation, but vets in new endemic areas and also in traditional endemic areas should keep in mind that the most effective way to control or to prevent the risk of infection is by applying repellents in dogs.